Hello, how are you today? I am Cynthia with Subconscious at Work and Healers Enlightened Network. I am here today to talk to you about abdominal cramping, mostly due because of the holidays, but we can have it all the time. So let's discuss abdominal cramping. Whether you have a mild stomach ache or serious cramping, abdominal pain can have many imbalances or reasons for the pain. For instance, you might have indigestion. You ate too fast, too much, too full. Constipation. Or you could even have a stomach virus. In women, it can be menstrual cramps because they certainly do cause abdominal cramping. Other possibilities that lay along that line is irritable bowel syndrome, Crohn's, et cetera, et cetera. The more serious diseases that you need to speak with your doctor about, we can remove as practitioners the symptoms of such, but we do not diagnose. If the pain seems to be more similar to crampy feelings, it may be harmless. This could be due to just menstruation, indigestion, or something benign. However, if the cramping over a 24-hour period gets more serious, please contact your doctor, call 911, or go to the hospital, please. Cramping pain can be also due to gas, indigestion, inflammation within the GI tract. And for women, it can be even endometriosis because it is very painful. Severe pain that comes in waves may be caused by kidney stones, just one instance. And remember that trauma to the body wall itself, like hernias and shingles, can also cause lower abdominal pain. And remember, abdominal bloating in itself is when the abdomen feels very full and very tight. It commonly occurs after the buildup of gas, whether it's in the GI tract or not. And also, bloating causes the belly to be larger than normal. And so it does get tender. It does get painful. And fluid retention does cause a problem with this. And although it might sound counterintuitive to drink more water when retaining fluid, drinking water can help the body actually reduce the bloating. Drinking plenty of water allows our bodies to naturally flush our systems of excess water and sodium that we may be retaining. Remember also that eating too quickly, some people just rush through their food. They don't enjoy each morsel, each bite. They just rush through it. Or they eat past where they are full. When you are full, stop, wait 20 minutes and see if you're still hungry. Remember that fatty foods and alcohol will also cause abdominal cramping. But do not eat when your anxiety is high, because this does cause indigestion. Gas, when it's trapped in your GI tract, is a result of your body digesting the food. And sometimes gas and indigestion can cause sharp pains. That's why as we grow older, we may need to add an enzyme to help us break down our food, because our enzymes do slow down as we get older. It seems like everything does. At a subconscious level, though, well, let me just say this. Cramping can be caused by fear. It can be caused by anger. It can be caused by hurt. Allowing people to so-called kick you in the gut, blaming yourself and others for your situation, and not ever finding fault within yourself. And even to the aspect of being stuck in a limited way to where you are not thinking clearly, you can't see a way out of the situation. But there is, and I can help you with that. So therefore, don't overeat. Once again, push away. Eat a fiber-enriched food, vegetables, and fruit. That helps your bodies get the fiber that you need so you can have a bowel movement 30 minutes after you eat. Make sure you drink lots of fluids. And some people, when I say lots of fluids, they think 3 or 4 glasses. I mean 8 to 10. And I know that sounds enormously a lot, but your body will appreciate it as you flush those toxins out. And you can add lemon to your water, but remember that lemon also removes the enamel off our teeth. So don't utilize it every day. But when your body gets sluggish, lemon helps to aid the liver in detoxing. Always wash your hands before you eat, like your mama told you. So you don't bring any germs to the table or something that you can ingest if you hit in your mouth. And don't eat right before you go to bed. The last time you should be eating is around 6 p.m. People that eat later and then lay down to go to sleep have acid reflux and have indigestion and several other problems because it's coming up and it's causing imbalances within their stomach. So make sure you get lots of rest because your body does heal itself naturally at night if the conditions are meant to be right. So we have to work on what is causing this. Is it a food that your body doesn't like or is intolerant to or is allergic to? Or is there something more going on? Do you have trapped emotions, like I said, of fear and anger? But something we can do to help ourselves. Our neurolymphatic spots are right here on our shoulders. And if we rub these spots and they are sore, then you rub them several times a day. Don't bruise them. Don't apply heavy pressure. Just rub them. That will help that neurolymphatic to come out of there. Also, on your left foot, you can do reflexology in the middle of your foot, but make sure you've got lotion or an essential oil to help you with that. And in our hands, it is right here on both of them. And also, you can do what we were taught by Lana Nelson, and you can go down your side and 1, 2, 3, and down the other side, 1, 2, 3, before you eat to activate your stomach enzymes. And also remember that your stomach is between 2 chakras. Imagine that you have a clock on your belly and you want to change the energy of that stomach because it's really bothering you. You want to go backwards very quickly, breathing, and then rub it slowly and bringing the positive energy around. It really does work. I use it all the time. And hopefully this will help you. It also helps with little ones when they get a stomach ache when they're nervous, or even us when we get a stomach ache when we're nervous. There's so many beautiful things we can do working with the chakras and the meridians to help you figure out the imbalance that you are having. So if any of this does resonate with you, please do not hesitate to give me a shout, set up an appointment, and let's help you. There's no reason you should feel rotten and have abdominal cramping because we all know it feels rotten to have it done. Okay, and I thank you. Thank you for listening to me. Remember, we have bi-monthly webinars. I do sessions on the side. I am a Reiki master and I do many other modalities, but I would be honored to help you. Remember, you can also test your own foods. It is simple as kinesiology, and it's called muscle testing. And it's as simple as this. It's not a strength thing. If it stays like this is a yes. If it breaks, it is a no. And you'll know that that food is not good for you. So you would ask, is this food for my highest good? Yes or no? Thank you. I hope these few tips will help you and yours with your holiday and with your abdominal cramping. May you be blessed. Namaste. See you on the other side.